Saturday afternoon in the city of Chicago. You are seeing us live, Facebook Live. We're here today to talk about COVID-19, back to school. And we have a wonderful and very experienced panel who's coming to you today that would like to discuss their feelings on back to school, this COVID-19, and everything else that we want to throw in here. We have about 5 people, so I'm not going to let us delay anymore. My name is William Penn. I'm your host. I'm going to try to take us through an hour and 30 minutes tour of this wonderful event. And so I would like to start by thanking my sponsors, our sponsors, organizations, Ada S. McKinley and the Chicago Urban League, who put a lot of time and effort into making sure that we get this live and get this going. And so I would like to start by having my good friend Kurt from Ada S. McKinley to come on and tell us a little bit about yourself.
Thank you, William. So my name is Kurt Holderfield. I am the Senior Vice President of Child Development and Youth Services at Ada S. McKinley. So I oversee all of our child and youth programs. So let me walk through a little bit about Ada S. McKinley and what we do and why we're here today, because this is so important. So Ada S. McKinley is an organization that serves over 7,000 people annually at about 70 different locations in a variety of services, including services for adults with disabilities, foster care and family preservation programs, and behavioral health and clinical services. But I want to focus on 2 programs that I'm involved with. The first is our Head Start and Early Head Start programs. We serve over 600 children ages birth to 5 in both center-based and home visiting programs throughout the south side of Chicago. There was some information that came out recently, some data that says that 2/3 of children in Illinois are not academically prepared to learn when they enter into kindergarten. That's a really big number. And we know in the neighborhoods that we're serving, where there are high rates of poverty, that number is even higher. In fact, because of the risk factors that those children face, they're anywhere from 80 to 90% more likely to have a developmental delay entering into kindergarten. And that puts them behind their more well-established peers. The good news is that the services that we're able to provide and the other agencies that are providing early childhood education services has a huge impact on those numbers. In fact, there has been studies that have been done at the University of Chicago that children who are provided early childhood education services at the earliest ages, there's a 10% return on that investment to that community and to those children, that they do better in school and they do better as adults. So those services are absolutely essential for those children. I also want to talk about our college readiness and our educational services program. So we service over 1,600 students throughout Chicago, South Side, and elsewhere who enrolled in Chicago public schools, both elementary and high schools. It's a combination of mentoring and tutoring. We help them to stay on track and to graduate high school, and then to move on and to enroll and attend college. We are very successful in doing that. So about 85 or 95% plus of our students are able to graduate high school and move on to college. The majority of these students are first generation students. So they'll be the first in their families to move on to college. And the nice thing about that is the majority of those students will pay little to nothing out of pocket for the cost for those colleges, because we're able to secure scholarships for them and financial aid. So roughly about 60% of the students attending the schools that we serve will graduate high school. So the fact that we're able to increase that number is really critical. I recently read some information, a study that was done at the University of Chicago, again, that 10% of young Black men who were freshmen in 2017, only 10% are projected to get their bachelor's degree. Wow. So I say all that to say, the services that we provide and all the organizations provide are really, really critical and are needed in our communities. But COVID has certainly put a strain on those families, and our services, A, are needed more now than ever, and B, we're challenged more than ever to provide those services. I look forward to sharing some more about that during our question and answer time. Thank you, William.
Thank you, Kurt. Wow. Listen, I got a couple of kids. I'm gonna call you later after the show and talk
Very
to you
good.
about the program. But that was really good stuff. I took some notes. I got some good questions for you coming up. Thank you. Now I'd like to introduce Angela Hamilton, my good friend over at the Chicago Urban League.
Hello, how is everyone doing today? Yes, my name is Angela Hamilton, and I am the Senior Director of Youth Services at the Chicago Urban League. The Chicago Urban League has been servicing the African American community for well over 100 years. Those that came before us have experienced the Great Depression, the Great Fire, and of course, the Civil Rights Movement. Well, in 2020, we are now experiencing COVID and the great racial divide that comes along with it. And those two combined experience is basically a recipe for disaster for our youth, our families that we service, and more particular for this particular conversation, our students. The Chicago Urban League has several centers that helps and focus on the wealth of the overall community at large. We have a workforce development center. We have an entrepreneurship and innovation center. We have a housing center to help with those families that are going through foreclosure and or needing, having problems with their rent. We have an impact fellowship program. We do research and development. And so what we have found in an effort to really focus on our youth in regards to reopening, that we have decided to operate under 4 pillars. Health and safety first. Health and safety meaning are we advocating that everyone actually follows the science and actually ensures that the processes that they're putting in place is safe for the families, the children. Then we have the second pillar, which is the family and community input. Why is that important? Because people want to hear, not just from the parents, but from the community at large. Our youth affect our processes, where we're going. They are our future. And so we all need to have a voice in that. Our third pillar is the intentional focus on equity. We know that being a youth or student in the African American community, it speaks in equity. You do not have the fourth pillar, which is the resources and the funding. They don't have the books. They don't have the computer laptops to give, right? And sometimes the families are unable to purchase those things. So what do you do now that CPS is going virtual? So the Chicago Urban League is a partner with CPS to do the Chicago Connected, which is where we are going out to ensure that those youth who are qualified get broadband for free. And this is for 3 years. We are a partner in that. We have over 2,000 families that we have to reach out to, and we are extremely active. Amid everything, please know that we have continued to service our families and our youth. We have given over $109,000 in scholarship money. We have continued to provide social emotional learning supports for our students. We have continued to be support structures for those families. Youth services all youth on the youth spectrum, those who may need support versus those who need stabilization. There is no real equation that says that a youth cannot receive services from us. And so what we try to do is just really make sure that we are available, that we are abreast of all of the things that impact the community so that we can be their advocate. And I do want to take the time to thank Ada S. McKinley for being a wonderful partner.
Yes, thank you so much. And I have a couple of questions for you when we get done too.
William, before you continue really quickly, I just want to make a brief announcement for folks on the line who are not speaking. Can you please just make sure to mute yourselves so there's no feedback?
Yes,
Thank you.
yeah, actually was going to say that myself, but thank you. You beat me to it. Now, thank you again, Angela, and we'll have some questions. I took some notes. I got some good stuff for you guys. So the next person, do we have our census rep on the line today? Because one thing that I found working within the world of the census world, that when we make sure everybody's being counted and we make sure those dollars finally get back to our state, some of that money filters into these good ADAS McKinley and the Urban League and some of the other experts we have on the line today to help in what they're doing. So I'll be quiet. Is my census rep there? Is it Corey? Corey, did we lose you?
Hi, William. This is Corey. How you doing?
I'm doing good, sir. Yes, we hear
Yeah,
you clear. Go ahead.
For some reason, my line keeps muting, so I apologize for that.
No
But
problem.
on behalf of my regional director, Marilyn Lake Sanders, and my deputy director, Elisa Johnson, I just want to thank the Urban League and ADAS McKinley for having the census here on this particular panel, and such an important panel. And why it's so important, especially for students and especially for people of color in the city, is the census, the 2020 census, will determine congressional representation, and responses to the 2020 census shape decisions about how billions of dollars and federal funds are going to flow into our communities for the next 10 years for our critical services, such as SNAP, WIC, our education grant. So it's very, very important. Healthcare, emergency response, schools, bridges, all are impacted by the 2020 census. And lastly, we've been affected by this pandemic, which we haven't seen anything like it in almost 100 years. The COVID-19 pandemic underscores the importance of census data in terms of census response and responses to emergency situations. So it's very, very important for individuals to complete the 2020 census. We want to make sure that we're counting everyone living in our community. It helps community leaders plan for our future, and it gets resources where they're greatly needed. What I want to let everybody know is that our self-response deadline is September 30th. So households, you need to be telling our students to make sure that they're getting their parents or their loved ones or whoever they're living with to make sure they complete this particular census count, either online or by phone or by mail, by September 30th. Okay. So I'll leave off right there. I'll answer any other questions that are related to the census. Well, I do want to make one last note that census takers are now on the ground. Our phase is called non-response follow-up, started July 16th, and now you should see people on the ground that can be identified with a badge and a bag coming around. These are individuals who are familiar with our neighborhoods. They're working and they live or are from near neighborhoods, and so they know our culture, they know our people, and they are here to make sure that we get a complete and accurate count in our neighborhood. So the non-response follow-up ends on September 30th.
Sounds good, sir. We really appreciate you and what you're doing out there for our Black and Brown communities. And we'll definitely stay on the line and mute yourself. We might do have a question from the audience a little bit later. I appreciate you being here. All right, you guys. And on this wonderful panel today, we got 3 more people, but due to time, and we know how we have to deal with time, I'm going to introduce their names, give a little bit of background on them, and then we're going to jump right into these questions, because they already got about 30 questions of people calling in and texting in to us. So again, I apologize if I mess up anybody's name. I've been practicing for 5 hours to get it right, but sometimes I still get it wrong. We have our good friend Carol Kilgallen.
Got it.
She is the Group Director of Business Development for Hartgrove Behavior Health Systems and our good friends over at the Garfield Park Behavior Hospital. Carol holds over 25 years of experience in behavior and health fields and bring a strong background in sales, design, and management, and manage a team of specific marketing and community liaisons. My other panel person here we go, Tamiko Dockery. Oh, she didn't say nothing. I mean, I must got it. is current the specialist program liaison, right? For the Hardgrove Behavioral Health System. She's also over at our good friends over at Garfield Park Behavioral Hospitals. In the Office of Business Development and Marketing, she brings over 20 years of experience working in this field. And don't look a day over 19, so we're gonna have to teach us how you do that. And our last panel, but not least, is Ms. Dorlawn Charles. Dorlawn Charles, hopefully I got that right. She received her bachelor's degree at the historical Florida A&M University in Tallahassee. I love saying Tallahassee, Florida. She majored in political science and minored in African American studies. While at Florida A&M University, she gained a wealth of political experience. Ms. Charles was a campaign staffer for several campaigns, including the U.S. representative of Florida's 2nd Congressional District seat and the 2010 Florida governor race. All right, thank you and welcome to everybody. So let's get started. So our first question right off the top, when this pandemic first hit, what were some of the useful protocols implemented that your organization still utilizes today? Let's start off with Carol.
So currently at the hospital, we have implemented it at the very beginning and continue to do so is the temperature checks at the front door. So any visitor, any police, any ambulance, we're doing a screening, asking specific questions about travel. We're also doing temperature checks on hand sanitizer. We're following CDC and the state guidelines around that, and that's what we continue to do. We also have done a lot of communication with staff on a daily basis, so that's something that some of those things that we're continuing to do.
Wow, sounds good. Your good friend that works over there with you, Tamiko, do you do anything different within your area, your department?
So to piggyback off what Carol said, we've been doing daily communication, weekly communication, call-ins. We did establish a hotline to do daily updates with our staff across all shifts. Certainly we've mandated, face coverings throughout the entire facility. We had stopped food deliveries from coming in, people ordering out and having food delivered. We've secured, PPE for our entire facility, and and our staff meetings, we were holding those virtually. So
sort of like our town hall today. Art, what you guys are doing, you guys are on the ground. You were, I guess some of your people are what they call necessary people that had to be out, even when we were on lockdown. Was there anything special that you guys did? Or still?
Yeah, so our services mostly are provided in people's homes and in schools. And so we had to move very quickly to a remote model and use technology and get technology into the hands of our families to do that. I was impressed with our staff and how flexible they were in doing that. We were able to get Kindle tablets and remote learning kits to all of our young learners. And our teachers were reaching out to them almost daily during the week so they can continue their learning. Our goal was to make sure nobody falls behind because of this. If one thing I think it's helped us to utilize technology more in a way that we weren't. So there are more ways now for us to keep in touch and communicate with our families. But like my other fellow panelists talked about, we've begun to reopen our childcare centers, and we've had to check temperatures and wear masks. Even our young children are wearing masks, and to do cleaning. And, we've really taken safety to a whole new level, and, to make sure that our staff are well protected and our children. So we've been flexible and nimble enough to make some of the necessary changes.
Sounds good. And before we go on, if you're just now joining us, this is a conversation with health experts about COVID-19 and back to school. We have our sponsors for this wonderful thing, Ada S. McKinley, Chicago Urban League, and we have the U.S. Census on the line too for future questions if you guys want to know how, and we'll maybe ask them a little later, how the census people are going around and keeping themselves protected because people are still signing up to get jobs to be the census taker. Angela, is there anything different that you guys are doing at your place or continue to do that you see maybe we should have did it before COVID-19?
Well, we definitely had to pivot quickly, and I think that's what the entire world did. It was a matter of you're open, what's happening with this virus? Uh-oh, all of a sudden we're shut down. So everybody, the entire world had to pivot, and those that are still standing pivoted very well. And so ultimately we went to a all virtual model. Youth who didn't have the laptops and the computers, they were using their phones. And we were very, very concerned, particularly for our youth who we know need additional support in regards to their social emotional learning, right? Being at during a stay home order where you can't go anywhere, people are not able to just like what's happening. And sometimes, unfortunately, youth like to leave the home because it's not a safe sanctuary for them, right? So we were extremely concerned about were they eating? Was there any, just abuse in the home? And so we did several groups allowing for us to check in with them 2-3 times a week. And then we've just tried to keep things upbeat. We still were able to do our STEM camp. That was 2 weeks long virtually, right? We still tried to keep a normal place in regards to it would at least resemble some sort of normalcy to them, even though it was at home.
Good, okay, I like that. You know what, I got one for Tomiko. Did I say that right again? Okay, and this is for you too, Carol, so you can think about it.
Absolutely.
Do you have any tips for people with living with an infected individual? So do you guys have any tips for people that are living with an infected individual? And then part 2 was, what do they do if they have to go to work? Should they still go to work? Should they, let's go to the first part and I'll ease us into the second part of that.
I'll take that. So if someone is living with an infected individual, they should quarantine and avoid going to work. Follow the steps of the CDC and what they've outlined for us. So we encourage people to use a separate bedroom or bathroom for a sick household member. So pick a get well room. The sick person should stay in a bedroom with a door, if at all possible, and not come out except to go to the bathroom. No one else should spend time in that room unless it's absolutely necessary, and children and pets should stay out. Keep a window open to bring in fresh air and to keep the air circulating. Provide tissue, provide bottled water. Also pick a quote unquote get well bathroom. So if you have 2 bathrooms, make one for the other household members and one for the person that's sick. But if you don't have more than 1 bathroom and everyone has to share the same bathroom, then you will have to go in and clean multiple times throughout the day, clean off all and disinfect all surfaces. Okay. We also should, help that person that's sick to track their symptoms, have them take their temperature several times a day without getting close to them, write down their temperature readings and document any new symptoms that might be occurring. And we want to make sure that they are drinking plenty of water, non-alcoholic beverages, drinking clear liquids, and staying hydrated. So those are kind of like the top 5. But we also want to keep them comfortable and entertained. So if we can make sure they have plenty of blankets and pillows and magazines, maybe an iPad or a TV or a radio in the room, help them with, making sure that they're eating and getting enough nourishment. So you might want to find a tray or even a cookie sheet or a TV tray to bring their food on and set it by the door and let them pull it into the room. So those are some of the top ones.
Sounds good. So now, Carol, this is how I want you to go into it. Hopefully I get it right. I'm asystematic, so I'm not showing nothing. I maybe took a test and I know I got it. But I'm also one of those, let's say, black and brown employees out here who, if I don't go to work, my family and I are going to be on the street. Should I go to work?
So that's a difficult question. And I think how we've advised is always talking to your human resource department. If you are asymptomatic but may have been exposed, and again, we're not medical professionals,
Right.
so always just making sure that you talk with your primary care physician and reaching out to them and getting that guidance, and always talking to your HR department, I think is always a good way. Because I know even with the frontline workers, that's a difficult decision. You know, you have to show up for work, and if you are been exposed, you just want to make sure that you're doing all the appropriate steps.
Sounds good. Thank you so much.
Sure.
If, you know what, we hear about our kids going back to school in this day and age. So let's jump, Dora. Do you know of any resources for family that don't have access to the internet, which is required for remote learning?
Yes, I do. So CPS has partnered with national and local agencies as well as community-based organizations to create Chicago Connected. Families can check their availability by visiting cps.edu/getconnected, or they can call CPS directly at 773-417-1060. They will ask you a couple quick questions, and then from there, they will let you know what are your next steps in order for you to get your internet connection.
Okay. That was really, what's that number again?
The number for CPS directly is 773-417-1060.
Thank you so much. So to all my experts out here, so anybody can answer this, or I can direct it to everybody. Our kids are acting out. They've been in-house all for a while. Now it's time to get them ready to get back to school. And we all know that the majority of the kids are now going to be going remote learning, at least for the first quarter. What can we do to get them ready? And to my behavior people, to get their behavior right. And we're not talking about the A, you know, every kid, he or she could be the A+ student to the, I'm gonna drop out when I'm a sophomore student, but they all still gotta go to school and they still have to participate. What are some of the things you want to tell us parents out here to get them ready? If anybody could jump in, or I can name somebody right off the top. Carol, you wanna take that to start off? And then
Well, I think I'm going to turn that one over to Tamiko. She's probably
ready to hop over to
site.
So I think one of the things that's important is, you know, we all began pandemic living March of this year, and everyone was kind of thrown into a tailspin. I think it's important to normalize this new normal, so to speak. We do know that our young people, you know, will have some anxiety. And at times they, you know, do feel isolated. And so I do think it's important to just support them during that, letting them know that that's not abnormal, but that we're always here as parents, leaders, community members, people of faith, you know, that we're here to support them and any changes that they might be experiencing. I think it's important to have great communication with the school staff and the school leadership to talk about partnering and working together if we're noticing, you know, certain warning signs. Yeah, so I'll stop there.
No, that was good stuff. We might have to get to come to some more. Good friend.
I do think it's important to really help them to also have a sense of safety, to know that, you know, we're here to, you know, support them, provide for their needs, be it physical, emotional, educational. So I think that's one of the first things that we talk about in counseling and in therapy. You know, we want to give them that space to be able to talk about things. And we want to provide them with resources, you know, should we need them. We can also help students plan virtual play dates, you know, or have some opportunities over, you know, Zoom or Google Hangouts, maybe to bring them and their classmates together.
That sounds good. Kurt, we haven't talked to you in a minute. What is you and your organization putting together for this first pandemic back to school?
So a couple of things. So one of the things we noticed right away, even before the summer, was just the level of stress in many of our families increased once COVID happened and kids were no longer attending school. They were losing those important resources and routines during the day. And so we really had to work with our parents in helping them to develop strategies to just make their kids feel comfortable and safe. The other thing was, in our behavioral health program, we have a mobile crisis unit that responds to kids who are in crisis and needing assistance. And our calls dropped dramatically as a result of that. So we knew that there was added stress in families, but we also were seeing that they weren't accessing resources in the same way. And that's because, that extra set of eyes and resources at the school wasn't available anymore. So we've had to make sure that our families know what resources are available and are out there to help them to access those resources. One of the things that, we're trying to do is partner with CPS to make sure that, we can get the contact information of families and we can communicate to them those important services because when they're at home, they are losing out on many of the supports that they would get at school otherwise. So how can we keep those coming into those families?
That sounds real good. And one of the things with everybody's going back to school and people are taking their children now to the doctors to get their physicals, their sports physicals down the road. And it's something that hit me or dawned on me. While the children are doing that, should we as parents get them tested? Now that we know in Illinois, we're really good about, you don't have to have a reason to go get a test, just get tested. Should we get them tested just to have a peace of mind and let them maybe teach them from a behavior, a peace of mind that they don't have it and they can, because of what they've been doing so far, is keeping them safe? Dora, what do you think about that?
With getting them tested, I absolutely think that all of the students should be getting tested if they are around individuals who potentially may have had COVID or if they are in large groups. And then sometimes just to be on the safe side, if they are showing symptoms, to go ahead and get tested. There are several different locations throughout Chicago and you can get the wraparound turnaround results quickly. So that is good as well.
Sounds good. Carol, over at your place, have you guys seen an increase in number of patients testing positive with COVID-19 over at Hargrove?
So we actually have been really fortunate. We've only seen 3 positive patients at the hospital since the pandemic started. I think what we did was we implemented a lot of safety measures. So screening before we accept any patients. So if any patients had any symptoms, we would require that COVID test before we would accept that patient. If they were to get symptomatic while at the hospital, we did design a PUI unit, which is a person under investigation, so we could isolate and then do the COVID test on site. So we did put a lot of safety measures in at the hospital. During this pandemic, we did keep our partial hospitalization program open. So we had a lot of safety measures put in there, but that allowed the students to see other peers. So it was good that we were able to keep that partial hospitalization program open.
Good, okay.
Live and in person.
Well, the next question I have is going to be kind of like for everybody, so I'll call out your name where you answer it, but everybody could kind of listen in and get the flavor and how they want to answer it. So, do you foresee new social and emotional issues emerging among students in this new remote learning environment? So I kind of touched on that earlier, but I wanted to hear what you guys say. Think of it from that perspective. And then Dora, when you kind of answer, maybe you could just tell us some of those wraparound services that might be available getting our kids ready for school. Let's start with Angela.
I absolutely do. My family, we have a regular Zoom call. And we allow all of the cousins and everybody to get on the Zoom call. So we have several college kids. One young lady, one of my cousins, she's at Jackson State with my son. She's in her sophomore year. And so we asked as a family, because we're concerned, how are you adjusting to the remote learning? Because all of their classes are online, even though they're on the campus. And she said, oh, it's okay, but we're having some difficulties because some of the older teachers or professors do not know how to navigate around Zoom. Or I'm not necessarily really grasping the information because it's all virtual.
Okay.
So with just those two things, what can happen easily is that a student may start feeling that they're not doing their best, right? That it's them. And that brings about stress, that brings about self-doubt, that brings, can affect somebody's self-esteem. And so I think that I hear a lot of people say, well, the teachers need to do this and the teachers need to do that. Well, let's being fair to the teachers too, right? The teachers were educated to teach, not to be the counselors or the social workers, right? So we have to give them a learning curve as well. I am like every other parent out here. You're a teacher, figure it out, right? However, we still have to give everybody grace in this process. There are counselors, there are social workers, there's a whole supportive team in schools, right? How do my best suggestion is you figure out how you can help the teacher identify the student who is struggling the most in regards to those social emotional learning deficits, right? And then connect them with the social worker and the counselor. The teacher shouldn't be doing both duties. It's just too much. And so I do anticipate that those youth will be struggling, right? I think we will have a high level of youth acting out, even though that they're at home. This is not normal. And while we are saying this is our new norm, they are wanting their old normalcy back. And we have to be, as advocates and as community leaders, we have to help those who don't know how to do it navigate that terrain.
Sounds good. That's really good. Kurt, you want to piggyback off of that and
Yeah, I think
tell us
that
what you're
I agree with what Angela's talking about. I mean, school is not just, and the students that we work, it's not just about helping them to, learn facts and figures and to get information from their teachers, but the social emotional learning component is really, really critical here. And we just know that, before COVID, a lot of our students were struggling in a number of those areas and needed assistance. And when they got that assistance, they improved. I think what a lot of people don't realize is that at CPS schools and all the ones that we were at, and we're in 10 CPS schools, there are a number of community providers. These are services that CPS doesn't pay for necessarily, that they're funded through other areas. Like our program, we receive funding from the Department of Education, but they provide a critical safety net for those students in those schools. And I appreciate all the conversations about how we're going to learn remotely, make sure kids have access and resources in Zoom meetings. I'd like to hear more about the conversation of how we make sure that those other critical supports, those other community providers are still having access to those kids. I feel like that's somewhat missing in the equation. We're working hard to partner with CPS, but they're also trying to figure out how they're going to manage all of the learning themselves. So there are more issues to tackle here. I don't know how long we'll be remote at CPS. It could be for the entire year. It could be less time. But I'd like to see us engage in more of a conversation of making sure that those other critical supports at those schools, like Angela mentioned, getting the social workers involved. We got to make sure that that's in place.
Yeah, I agree with you, both of you. And what we've done on our team at Hartgrove Behavioral Health Systems and Garfield Park Behavioral Hospital is that We maintained our communication with CPS school social workers, counselors, nurses, speech pathologists, SAS agencies as well. We've offered some trainings over the course of the summer, but we just met with 200 CPS school social workers and counselors last week, just letting them know that we exist, what services we provide, what our specialty programs are. And we want to support them as they support families and students. And we'll continue to do that with them. So this definitely is a meaningful partnership. And these type of forums are very important to the work that we're all trying to do.
And just to add to that, during the summer, we also offered a teacher support group for the whole summer.
Mhm.
Also for the social workers, because we knew that was such a needed component just to support them and have that space to be able to open and have that dialogue on what they're stressing, what the stressors are. So.
Great. That's good conversation, you guys. Look like we're going to have to do another one of these, and we'll hopefully continue this conversation. Before we move on, though, I want to make sure our audience out there start typing in your questions, because after I get through the questions that I have here and the ones that are popping up, I would definitely like to have more, because these guys are ready and there's nothing can stump them, even though I'm trying. Nothing can stump them. They have all the answers. All right, you guys, let's see. Doral, I'm sorry. Did you have anything to put in on that, that last question?
Yes, I would definitely love to add to that. So as the educator, there's going to be a couple new social emotional issues that might arise within your child that you would notice. Number one, just being overwhelmed, easily frustrated, being angry, shutting down. Some of the things that you can do is get them organized, get them a planner, a calendar, put that somewhere that they can see so that they know exactly what would be their daily goals that needs to be completed. Also, they may be consuming too much unhealthy screen time. So maybe limit how many hours per day they're on the computer, they're on their phones, because, there's a lot of things that they're looking on the computer now that they may end up feeling angry or upset about. Also, they might not be able to articulate properly how they might feel. So check in with them, have that conversation. You know your child better than I know your child. So if you see that they're withdrawn, if you've seen that they're starting to be a little bit sad or depressed, they're not talking as much or eating as much, get them active, have them go outside, get that vitamin D. I love being out in the sun. That's why I have such an awesome chocolatey skin, right? So having them to also doing those calls to home, FaceTime, their friends, that would be good. Although they might not be able to go see them outside, having them to, just call them on the phone or text them to making sure that, hey, I have a friend who I can talk to if they may not be comfortable with speaking to friends or family members.
Well, on that note, let's stick with you here. So our next question or concern might be, so we know COVID-19 has spread quickly throughout schools and universities that reopened too quickly, or just open in general, in different parts of the country. And we see that they're now actually have to shut down. So at some point, CPS and our Chicagoland schools are gonna open, hopefully January or so on and so forth. So in your response, where do you feel comfortable in the level of feeling, how as parents should feel comfortable in letting our kids go back to school?
Personally, I do not feel comfortable. I do not feel safe. I think COVID-19 has just too many unknowns. And for me, unless it's completely eradicated, I don't think it makes more sense for us to go to the school building. Little kids carry germs. I used to teach kindergarten my very first year. And let me tell you, I got sick about 5 times within one school year. So imagine an airborne disease, right? Where we're not sure if our little ones can keep that mask on all day. Even me as an adult, I struggle. So in order for me to not wear that mask, you know what? Let me just stay home. So I'm not comfortable. I have heard a lot of different things from parents as well as students. There would have to be some safety measures put in place so that we can limit as much contact as possible. Hopefully we can get everyone tested get everyone tested and have other agencies come in to pour a volunteer in terms of getting face masks. I know CPS has already said that they will be giving families face masks to use. We are going to need additional hand sanitation wipes, and those type of PPEs would be definitely good for our school. However, remember, little kids definitely carry a lot of germs, so it's going to be kind of hard to contain it. But for right now, I'm not comfortable. But we will see. We'll keep hope alive. We will see. I'm trying to stay positive.
Yes, we need you to stay positive because we look to you for the answers. Oh, okay, you guys, look. What are some of the actions you think we should take as a community in order to minimize the infection rate moving forward? Let's start with Carol from her expertise area.
Sorry, I'm on mute. I apologize.
That's okay, Carol, we hear you now.
Wearing the face mask. That is so important. Not only wearing the face mask, but wearing it appropriately. Making sure that you're covering your nose and your mouth. And I agree with you, Dorlin. It's difficult for the kids to wear them appropriately. So I know what you're talking about. Social distancing.
Mm-hmm.
Making sure that you really are. I mean, there's so much put out there from the CDC on this, how important that social distancing is. Education, I think there needs to be some education around appropriate wearing of the face masks and the different things that you can do. I think that access to PPE is a huge one. Access to the appropriate PPE. Where do you go? Where is there a reduced places where you can access that PPE is important as well.
Sounds good. Hey, Corey, are you still there from the U.S. Census?
I will. I'm still here.
Sure. I know you've been chomping at the bit to say something, so we want you to answer that question. But how are the census people keeping themselves safe, and what are some of the things that they're telling the us people who haven't done our census and helping them to get it done, that they're all keeping them safe there? Because that's been on top of mind with a lot of people. So I just wanted you to chime in while we're talking.
So it's been the Census Bureau utmost responsibility to protect, both its employees, but also, and most importantly, the public. And so we've just been following all the local, state, and federal guidelines in terms of COVID-19. And especially for workers that are out in the field like myself, but also now even a larger body of census workers, census takers. We had to complete training about how to protect ourselves and protect the public. So on social distancing and safety protocols, and we're following those to a T. We always have to have face masks, and when we're interacting with the public, gloves. We're definitely practicing social distance of more than 6 feet. We are limited in terms of the type of interactions we can have with the public. So we can't, go into large crowds of more than 100 or 50 people in some places. And if we are in those places, we have to maintain a social distance of 6 feet. Some of us can't prevent it. And then practicing good hand hygiene. I think what some of the panelists have been saying about normalizing the unnormal about education. And I used to be a teacher, for 7 years in between decennials. So definitely know about how you have to normalize and always reinform these ideals that you want people to norm behavior. And so that we're doing that with our workers all the time. And for census takers, we're not entering homes. We're conducting interviews outside as much as possible and as practical. So we definitely are just trying to ensure that we protect the public, protect ourselves, and make sure that we're not, causing or helping the spread of COVID-19.
Sounds good. Thank you. Angela, with you being over at the Chicago Urban League, I would love for you to chime in and say, because it's a community thing and the Chicago Urban League is based and rooted in the community in a lot of programming and stuff, what are you guys doing, some of the actions you're doing to keep the community safe so we can keep this infection rate down?
We actually have a COVID center. It's a COVID help center. So if they call our main line, 773-285-5800, and communicate their needs in regards to housing, workforce, entrepreneurship, youth services, anything along those lines. They will be connected to one of the directors right away. There's a form that, few questions so that we can kind of understand on a global level what their concerns are. If it's housing, I can't afford my rent, I'm getting ready to get kicked out, I'm getting ready to go into foreclosure, how can I help? I was in the middle of purchasing a home, I had a credit hit, can you help me repair my credit? Those are the things that you ask for housing. If it's workforce, I got furloughed, I just lost my job, I got a job, but then they furloughed me. What do? I need some tips. How do I update my resume? You can call that number. For entrepreneurship, I'm a business. The economy has almost made me bankrupt. What do I do? How do I get back on track?
Right.
You can call that number. Again, for youth services, I don't know how to navigate this back to school, new norm, reopening type process. I'm scared out of my mind. My child has learning disabilities. I don't even know, whatever those issues are, they can absolutely call and somebody will get back to them right away. We do not take this lightly. We know that those in our community are going to need help. They're going to need guidance. And we are here to be that beacon of light for them.
Thank you. Tamika, you over there want to say something, so come on in here and talk to us. What you got?
What I'll do is I'll speak from a private school perspective. My daughter attends a private Montessori school, and we've been in communication with our head of school and our board of directors since the end of June, the first week of July. And so we've all worked as a community collectively to create a safe return plan for all of our students. Some of the things that we've done certainly is what everyone else has mentioned in terms of masks, having hand sanitizing stations throughout the school. They've added air purification systems. The pods will be a class size of 10 or less. We'll be utilizing all of our outdoor learning space. There's a farm, they'll be utilizing that space as well. But one of the things that really stood out to me was two things. One was letting parents know what the expectation is going to be so they can communicate that to their children before they even begin. Another thing they did was hire additional Montessori teachers and train them even on the technology, just to, in case a teacher gets sick, then you have another teacher that's full-time, that's ready to go versus a substitute teacher. They've added webcams to every single classroom, so that way other students that opt not to return can do what we're calling parallel learning. And then they've also created a COVID response team. And so those parents in the school that are physicians or doctors will work on that response team. And I also went through and completed the Johns Hopkins training to be a COVID tracer. So we have a team of 12 parents that will be monitoring and tracking, but also we have an electronic tracker. We get a notice every single day, and it's a small, brief health questionnaire that we have to fill out before the children return to school, and we have to do it every single day. So I think we've taken a great precautions to ensure a safe environment for the kids to return.
Wow, that sounds good. That's good. So let me let my audience, my panel, everybody know. We got about 15 minutes left. So I'm going to take a couple questions from the audience. But I want to leave a little time on the end so everybody can give like a closing statement. Sounds good?
Sounds good.
All right. So first question from the audience. This is for everybody, and I'll run off the names. What if I have an older child that can't log into class because they need to supervise their younger sibling while I am at work? That's a loaded question, but I guess they're trying to say is, any not resources, anything that you can teach us parents to how to make sure if I leave, I have it in my house. I have a senior in high school and I have an 8th grader. I need to make sure my senior is doing her stuff, but she also got to help the 8th grader. What is there anything that you guys can, as moms or dads or whatever, to help people navigate that type of situation?
I think it's important to have that open line of communication with the teachers. So let them know what the situation is at home. Make sure you're continue to checking in. If you only have that one device, go ahead and divide up that time. Is it okay to work in shifts? So you would work in the morning time, and then that sibling will work in that evening time, so that you're not clashing in terms of getting that work done. But definitely reach out to the teacher, send a quick email, phone, text, to let them know, and they are more than accommodating. Remember, we are trying to drive or fly a plane as we're actually building the plane. So we're definitely gonna be very flexible, but if we don't know, we won't be able to help out. So definitely communicate with your teacher for sure.
That sounds good. Kurt, what you got to say?
I think Nurlan actually had a great response. I think it is a lot of communication with the schools and letting them know what's happening. You know, and you know, I have a CPS high schooler, and you know, when he went through the initial remote learning back in April and May, the teachers were really great in following up and communicating and being flexible. And I'm hopeful and optimistic that that will continue. So our experience was teachers do listen, they do understand, and they will make adjustments and try to individualize learning as much as possible, because this is our reality. And this story is going to be multiplied over many, many, many homes. So I think that, again, that communication is absolutely essential.
Sounds good. I think Miko got something to say, but I want you to answer it from the perspective of, do we do some bribing? Are we putting some incentives out there? So my senior, she'll get an extra $100 a week as long as she's making sure that both of them getting all A's. What do you think?
I think a car for sure. We should get them a car.
Sound good, Carol?
I think in times like this, we have to be super creative, you know, but we're also working doubly as hard, you know. I do work from home as well as in the field. And so when this all started, you know, my husband and I were trying to juggle our work responsibility with making sure our 9-year-old was doing what she was supposed to do. And every time she wasn't. But that communication with the instructor is very important. And, you know, we just asked for what are all the assignments for this week, so that way we could kind of stay on task. So even if we couldn't help her in that moment before the end of the day or before bedtime, we got those assignments in. But again, we were communicating offline with her instructors, you know, to make sure that we had met all the requirements. And sometimes it even meant some work was held over to the weekend, you know, but we certainly got it in. And so flexibility is really important, and understanding, I think, having dialogue with the instructors, with the teachers, to make sure that they are going to allow for some flexibility. It's my understanding they are. My husband is a CPS school principal. He is asking that his teachers block off small 10 and 15-minute increments of time to be able to meet with students and parents, you know, virtually. So we have to all be creative and do what works for us. So, I don't think there's any wrong answer here.
I don't think so either.
Well, Carol's buying my senior a car. So Carol, you guys all heard that. So Carol, what do you think about that topic?
Well, I have a sophomore, so I think, as I'm agreeing with everybody, just that communication with the instructor, making sure what I've done is making sure that I get a weekly update from his teachers, making sure that all of his assignments are completed. So at least at the school district that my kids goes to, I'm getting that communication. I know what's missing, and just really as a parent, making sure that you're staying on top of and having that communication with the school.
Sounds good. So before we get to the next question, is there anybody on the panel want to ask somebody else on the panel a question or something? Got all these experts here. You guys got to put your brains together and help us figure this out. Is there anything? Because I got more questions for you. You guys, give me a chance to talk amongst yourself just for a second. What we got? Oh, so you guys all think you know everything on your own. I got you. So here we go. Next question from the audience. We got We got, let's see. So we have a call, I guess somebody texts in here. How do you, I am a parent, I am not a teacher. I barely have my 8th grade education. My kids is trying to want me to teach them how to do the new math. Now, I don't even know how to do the old math. What help and resources are out there? I can't help my child in none of her classes.
Yeah, I think the standard answer still is going to be keep the line of communication open with the teachers, right?
Okay.
They can absolutely call the league through the COVID Help Center. We do have a tutoring resource. I'm sure Ada S. McKinley has something along those lines. There are community-based organizations that are available to help in the academic enrichment. But again, the communication with the teacher is so important and critical because they may be able to send, you know, not the answers, but the blueprint, or be able to, you know, say, hey, this is how you get, the answer is 12, but this is how you get to 12, right? They may be willing to do that so that you don't miss a beat. And so those are my recommendations.
Okay, I'm going to give Kurt opportunity because you called him out and say, what you guys doing? So
well, first of all, I want to say there's no shame in not knowing how to do the new math. And as a parent who's tried to work with my kids, oftentimes I've been stumped, and that's just the reality. And let's face it, you know, all of us who are parents are working very hard and have other things going on, and it's stressful and it's hard to be there for our kids. But Angela's right. I mean, we have tutoring resources as well, and we've invested in online tutoring resources, and we've made those resources free to the parents that are and the children that are enrolled in our programs. And again, I think it's reaching out to those schools and finding out what resources exist there, what community partners are there. I think it's our job too as community partners to get the word out about our services because they do exist. So I would encourage parents to take advantage of what's available. And that may require a little bit of work of you know, contacting the school and finding out, but those resources are there and are very useful.
yes, thank you, Kurt. That was really on point. Okay, you guys, here's the last question until we go into you guys' final thing. So, from the audience, my child has some detachment issues now in going back to daycare. They've been acting out in front of their teacher and I guess their peers at that time. They ended the question about what should I do? So we're short on time. So I need a couple of you guys to kind of, my psychologists over there, like Carol and Tamiko, maybe give me a little something real nice and short to help my parent out, and then we get into our final question and just our goodbyes.
I'm actually going to open that to Tamiko or Daisy or Christina if you guys want to jump in on that question.
Yes.
Daisy, coming from CPS, you might have some.
Yes. Can I just get clarity on the first part of the question? Is the child having attachment issues because they're away from the, like with the teachers or with the parent?
Well, let's go with
the way it was phrased.
Let's go that I was there. I loved being there. I got pulled out because of COVID-19. So now I'm used to being at home with mommy and daddy all day with the doggy. Now, mommy and daddy want me to go back to over here. But why? I love being home with mommy and daddy. So I'm going to act out.
Yeah, and I think we have to kind of see it from the perspective of a time of transition and constant changes. We're all collectively experiencing a pandemic, and just the changes that happened, they've happened so drastic, right? And so I think based on what it sounds like, it definitely seeking mental health support. And one of the things that I wanted to bring up a little bit earlier is in encouraging the parent to seek support for themselves to help their child manage some of the acting out behaviors, because a lot of the times the parents are their first teachers, and so we want to make sure that the parents are cool, calm, and collected, and that they're able to handle these tantrums, and they're able to kind of like process the difficult feelings that this child may be having. They're missing the structure, they're missing their old lifestyle, they're missing their peer-to-peer contact, and you want to be able to find other creative ways to really bring up their protective factors to reduce any depression or any anxiety that may arise as a result of what we're all experiencing.
All right, Daisy, thank you so much. You should have chimed in a little early there. Well, I appreciate you. I appreciate what you said. Okay, guys, we made it to the end. Final question of me drilling you guys. You guys have made it through. I don't see nobody sweating but me, so we're doing good. Here we go. So we only got about 6 minutes, so I know everybody want to have a lot to say, but just kind of get to the high points at the beginning, because I might cut you off, and I'm not going to be rude. Here we go. Is there any other critical information that you would like to share with the community members and viewers? What do you want them to take away from this event? And I'm going to go through my boxes on how to start off. So Tamiko Dockery, thank you so much, and you're first.
Wow, you know what I want people to take away from this is that we're all trying to cope, you know, and this is a very fluid situation, and let's be patient with ourselves. Let's be patient with each other. Let's, you know, extend help in all the ways that we possibly can, you know. I just want to say, let's just be forgiving as we enter the new academic year, the new school semester, and just pack your patience, you know. Something that Daisy hit on is that our energy, we transfer that to our kids, we transfer that into the school environment, into the workplace. And so I think we have to just be really careful and mindful about the message that we send. Let's just kind of realize we're all working through this together. Even what we are doing today over Zoom, you know, we're just all trying to best support one another. So I think it's important to just keep that in mind.
Sounds good. Kurt, chime in for me. From A to S McKinley, what we got?
A couple of things. One of the things that we've been really challenged with is this sort of balance of mission and safety and health. And how do we continue to provide our mission and carry out our services and make sure that everybody who's getting those services is safe and healthy? I was just thinking about the conversation about the child transitioning into the classroom. And in our centers, we're under some regulations about, you know, parents aren't allowed to come into the classroom anymore like they were before, or that, you know, there's only certain items that can come into the classroom, like plush toys. So I was thinking sometimes a transitional object for a child is helpful. So we placed some restrictions that have made that challenging. I understand that we need to be firm to keep people safe, but we also need to find ways to make sure that, you know, we are providing the adequate services. So feedback from those that we serve is really important. We need to hear from all of the families and clients that we serve about what's working and what's not. And we as organizations need to be responsive and flexible to that. Because Tamiko's right, we're figuring this out and we're building the plane as we're flying it. So it's not just the schools or the hospitals or the community providers needing to figure this out. We need to hear from our parents, our families, and our communities that we serve.
Thank you, Kurt. That was really profound words there. I really appreciate that. Angela Hamilton from Chicago Urban League, what do you got for us?
The biggest takeaway that I want people to get from this is you're not alone. Everybody is experiencing some level of adjustment. We are all having to pivot, make a change. We might have thought we were going left. We're not going right. We're in a standstill, all of that. There are resources out there. Everyone on this call, on this Facebook Live is here to help you. We are all full of resources. If I don't have it or I don't provide this service, I know that I can reach out to someone else and provide you that resource. You are not alone. You do not have to navigate this by yourself. I know it feels overwhelming. I know it feels like you're getting nowhere fast, but know that you are not alone and we are all here to help you.
That is really good. Here we go. I'm gonna try it again. Dorlan Charles, you got 1 minute.
Seconds. I would say, as a social studies teacher, there's going to be a lot of things in my classroom that we're going to have to talk about, whether it's the election, whether it's the protest, whether it's the looting that's been occurring, or whether it's gentrifying Chicago on the South Side, right? I will say, have conversations with your kids. We're going to be talking about a lot of controversial topics. Check in on them. See if they're okay. Do some mental health breaks, you know, every once in a while. If you notice your child is starting to be depressed, they're starting to be frustrated, close the laptop. You know what? Hey, Miss Charles, I don't think my child is going to be in the classroom today. They need some time to just, you know, decompress. I'm okay with that. And I will, you know, respond right away. I have 2 laptops, my school laptop, my personal laptop. And guess what? I pay this high AT&T bill. So I will get your email. I will get your text message. Leave me a voicemail. Have that communication. Go to the virtual town hall meetings. Make sure you go to the orientations. Make sure that you know who your child teacher is, right? If they are at the middle school, high school, know all 5 or 6 or 7 teachers. You know, ask those questions. Go to that clinical specialist and say, hey, I noticed this about my child. What are some tips that I can do? The school social worker. I know for me, my 8th graders are going to go to 9th grade come next year. I've had them for 2 years. Those are my babies, right? So make sure that you're having those conversations. Well, now that you're having school virtually, do you think you're going to be prepared for high school next year, right? If they saw a protest that's happening either through Snapchat, right? It's a viral video and they might seem a little frustrated. Tell them about your personal interactions that you may have, you know, whether that may be police brutality, getting stopped by the police. Try to do some things in terms of calming them down. Even me right now, I'm stressed, right? So I have a little candle that's making me feel a little bit more calm. I'm drinking a lot of water. So having your child stay hydrated. Also clean up their diet, guys. I know they're in the house, but limit the junk food. Try to get a little sweets every now and again. Also, please make sure they are starting to go to bed a little early, right? Train their sleeping patterns, because once we start at 8:45, I will be on the call at 8:45, okay? Make sure you get them signed up for Google Meet, any other avenues. And also, if you are one of those parents who struggle with math, you know, Khan Academy has how-to videos. They will teach you, or get your degree from YouTube University, okay? There are a lot of people on YouTube that will teach you how to do that slope equation that you completely forgot how to do. Thankfully, I'm a social studies teacher, okay? So that is not my area of expertise. I stay in my lane, okay? So if you are struggling, there are a lot of different educational tools that your teacher will definitely show you of how to complete those steps, okay? And trust me, even if you cry, we're gonna cry together. You and your child may have a woo-saw moment, but we will all get through it together.
Sounds good. Carol, I got a minute for you. Don't forget you're giving my baby a car.
You'll have to privately chat me which kind of car he'd like.
You got it. You got it. What would you like people to take away from this, and from you?
So I think practicing self-care is really just taking care of yourself, and always keeping a temperature check on your children, making sure you're having that open communication, laying eyes on them on a daily basis, just making sure that they're okay, because it is such an unknown right now. Keeping connected with family and friends, and reaching out to professionals if you should need any assistance, need any social support. But there's a lot of good providers out in the community, and just making sure that they can access that.
Thank you so much. I know what Corey's gonna say, do your census, but we're gonna let him finish. Corey, you got a half a minute? Okay, Corey, fine. Ms. Gomez, you did chime in for a minute. I got a few other faces up here. Corey?
Can you hear me, Will?
Okay. We can hear you now. What you got to say? What do you want people to take away?
Yeah, so I know I don't have that much time, but I heard 2 things about safety and just resources. And I just wanted to talk about just how ubiquitous, in terms of some of the resources you all were talking about, education and mental health, and just even the nonprofits that have allowed the census to be here about doing the census. And I just wanted to talk about community care. And then also different ways to just stay safe, right? So the best way to do that is by just self-respond. And the way you can self-respond is by going to 2020census.gov and doing the census online. For those who want to do are less technically challenged, you can use the phone line. We have an English phone line, which is 844-330-2020 in English, and the Spanish line is 844-468-2020. And then we also have different assistance in different languages as well. And a lot of our neighborhoods are under 65% in terms of self-response. And so they will be getting a last mailer for individuals who love to do the census by mail. You should have that by September 15th. So 16.5% of the households are going to receive a final mailer. And a lot of our Latinx and Black neighborhoods in the city will receive that. So be on the lookout for that. And it's about community care. We're trying to boost our neighborhoods for the next 10 years. So please fill out the census. Thank you.
Thank you. And I want to thank Mr. Griffin, Ms. Gomez, Ms. Ramirez, Stephanie, and Mr. Butler for chiming in and being a part of this wonderful thing. Thank you, everybody. We've gone over 5 minutes, but I think Facebook is not going to charge me, so we're good. You guys really taught me a lot. I'm getting ready for my kids. Carol, we're going on the sidebar, I'm going to Instagram you or whatever it is. But thank you so much, everybody.
Thank you.
I think that when we do open the schools, we probably need to get the group back together and do it again so we could teach our parents and myself how to get those kids ready to hit the school for the first time. Thank you, everybody. Everybody, my name is William Penn. Have a very good weekend. And thank you for spending this hour with us and learning about COVID-19 and back to school question. Back to school. Thank you.
Thank you.
Thank you all. Thank you so much for joining us today.
Bye-bye.